Head injuries. Now, head injuries are a common problem, and in some cases they require very little treatment. But please always be aware that problems can sometimes not be that obvious to the first aider. Your brain is a very sensitive organ. It's surrounded by a solid bone such as a skull, and it has fluid to protect the brain further. But you should always suspect spinal injury with a head injury, and you need to assess the way that the injury happened and make your decision if the spinal injury could have happened. When a head is damaged, there are different conditions that can happen, and these are from mild to the more serious. Now, when dealing with a head injury, you need to establish what level of consciousness this patient has, and you can use the AV-POO scale. This means alert, voice, pain, or unresponsive. In other words, are they fully alert? Are they able to respond to your questions? Can they open their eyes? V stands for voice. Can they answer simple questions or command? P, pain or pressure. Do they respond to touch, to pinching, to you putting pressure on them? This could be you pushing on their collarbone, just pinching underneath their arm. Does that cause them to open their eyes? Or U for unresponsive. This is where the patient does not give any eye, voice, or any other motor response to voice or pain. You need to ideally record your findings and repeat your assessment so you can report it if there is any improvement or deterioration in that casualty's condition. So always time when you did the first check and then do another check maybe 5 minutes afterwards. If you have any concerns, always activate the emergency medical services, as head injuries can be very serious. Now, we have 3 types of head injuries: compression, concussion, and skull fractures. Skull fractures are where the skull is fractured due to direct or indirect force. There is sometimes blood, which is straw, coloured or clear fluid coming from the ears and nose. There could be blood in the whites of the eyes, and there could be evidence of impact by showing depression or bruise. Concussion is when the brain can move a little, and the shaking of the brain due to the blow to the head can cause somebody to have concussion. So this is your skull, this is your brain. Your brain can rattle around inside your head. A concussion usually produces a temporary disturbance to the normal brain function, and symptoms of a concussion can be mild to the more severe, and in some cases emergency treatment may be needed. The most common symptoms of concussion tend to be a headache and feeling dizzy. They might feel sick, nauseous, and they might have a loss of balance. They might be very confused and they have problems with their memory. Now, compression is where there's pressure on the brain caused by swelling or bleeding, and this is a serious condition. The swelling can be due to a build-up of blood within the skull or swelling of injured brain tissues. Compression is usually caused by a head injury, but it can also be caused by a stroke, brain tumour or infection. So if this is your skull, this is your brain, there's pressure building up and that has nowhere to go and it can burst. And that can lead to death quite quickly. The signs and symptoms could be a change in someone's personality. They could have deteriorating levels of consciousness. They could have noisy breathing which becomes slow. They could have an intense headache. They could be vomiting. They could be drowsy. If you check their pulse, it could be slow but very strong. Their pupils might be unequal. They might have weakness or be paralysed down one side of the body. They might be tired and there could be evidence of injury. Now, signs and symptoms can occur up to 48 hours after being hit on the head. The treatment for head injury is basically the same though. Be aware that there could always be spinal injury. I'll ask the casualty to sit down in whatever position they find comfortable. I will give them an ice pack. An ice pack will help reduce the swelling and also reduce the pain. I will then be talking to the casualty to find out what their symptoms are. I'll be testing their memory. I'll be looking at their pupils. I will also be seeing what their speech is like, because if I was concerned, I'm always going to be alerting the emergency medical services. If there was a bleed, I'll be bandaging the head up to put pressure on that bleed. And I'd always be advising anybody who's under 18, over 55 and who lives by themselves to seek medical attention with a head injury. Finally, it's also worth mentioning that what to do with a patient who's wearing a helmet. Now, a helmet could be a cycling helmet, a riding helmet, or a full motorcycle helmet. These are very good ways of reducing injuries to the head, and they're best left on, as by removing them you can make things worse, or put extra strain on the neck, making a spinal injury worse. However, you might need to remove it if you cannot maintain or open an airway, or if they're not breathing. If you do need to remove the helmet, you must do it slowly and carefully, and ideally with two people, one trying to keep the head in line with the body. First, you need to make sure you remove the strap, so undo the strap and remove it and kind of prise it apart. And the other person's going to hold the helmet while the other supports the neck, and the kind of helmet gets rocked off slowly. And ideally, whatever helmet someone's got, that must go to hospital with the patient, because that can actually help the paramedics and emergency medical services identify whereabouts on the head this person's been hit. Now, I would always advise further medical treatment for anyone who's under 18, so any child or baby who has a head injury. You should always advise parents and carers to go and get them checked out. I would also do the same for someone that's over 55. You know, the old and the young, I would call them in the high risk categories, and you want them to go and get checked out. And ideally, anyone that lives alone, you should encourage them to go and seek medical help, because signs and symptoms of head injuries can occur up to 48 hours after the head injury takes place. And people think that you have to be unconscious to have a serious head injury. This is not the case. You do not need to be unconscious to have a serious head injury. I believe you should always treat head injuries really seriously. Don't forget to hit that subscribe button so you don't miss out on any of our important videos.